Hi, Chris Freeman. I am in Valencia, California, which is actually Magic Mountain. A lot of you guys probably know me from the sports world, and we're not far from the sports world. Today I'm with Dr. Schlag. Did I get that right?
Yes, you did.
And everyone just calls him Dr. D. So just if you see me, you can call him Dr. D. So we came out here today. You're doing some stuff on me, but you're kind of my kind of guy. You were actually the Oakland Raiders team doctor for a good number of years.
Los Angeles Raiders.
That's right. When they were back in LA. Okay.
Right.
Okay. So tell us about that experience a little bit.
I started in 1989, I believe, and I worked for over 10 years treating the players while they were all living here in Los Angeles. And I took on that assignment because I thought it would be great fun for my two children to grow up in a professional sports team's locker room. And that turned out to be true.
So now, I mean, we'll look on the wall here. You're actually on the field with Al Davis, and you get your picture with him. And so, how long did you do this for?
I did it for over 10 years, actually over 15 years. And during that period of time, we cycled through about 3 year. The average life of a professional football player is about 5 years.
Right.
So every 5 years, the roster of a team would change. So I did about 3 cycles of players. And
so during that time, you've met with some real, I mean, probably Hall of Fame guys and
right.
Some of that. Is it any different dealing with someone of that status versus dealing with your normal patient, in Valencia, California?
Well, one of the things I found is that the professional athletes, their career and livelihoods were very intimately tied to their health. And they were very astute and smart medical consumers. So they picked and chose their medical people very carefully, and consequently, once you were in the inner circle, you stayed there. So they stayed. There's many of the players who I treated, who I have now been treated for over 15 or 20 years, and they'll travel from other parts of the country where they live to continue seeing me.
Something like dentistry, where researching the topic lately, because I've had interest in it as well. Is Hollywood seemed to have attracted a lot of some really good dentists that because of the presence on TV or on wherever they're at and the importance of a smile and that type of stuff. That people do travel long distances to see you. That's common, right?
Well, we have a lot of patients who are either outside of the state or outside the country who have been seeing me for quite a while, and I think that that's partly once we've developed a relationship and the patients are accustomed to a certain standard of care, they want to make sure that that is perpetuated.
Right, and it's like you said, the athletic community is a little tight-knit group. It's kind of how I met you because your friend knew that I was in the athletic kind of at a higher level, and we introduced each other. And he said that you were the team. I go, well, I want to meet him. That's the dentist I want to go to, and we just kind of hit off. But just because athletically minded, and I was just kind of interested in the whole thing, which is really cool.
Well, the other aspect of it is that since all the years of practicing in Beverly Hills, the part of the key to dealing with that celebrity echelon is patients could come in and their privacy was respected. Right. So there wasn't a waiting room full of people looking for autographs.
Yeah.
They had their treatment and their work was done confidentially, and that was a very important component to building that kind of practice.
And I know that, and that's why I haven't even mentioned any names that I've seen the pictures you with and stuff like that, because I respect that as well. So that is important. So some of the practices today is much different than they were even like 10 years ago, but that have really been fine-tuned. Like I'll say it, you fixed my upper teeth today, and it took a few hours, but I was amazed that you could really do what you did, just like little gaps, little chips, and stuff like that. And what's your real specialty? I know you work with your partner, and you guys do your implants, your veneers, bonding.
Well, one of the things that Dr. Razi and I do together is that because of his experience of teaching in UCLA and all the experience that I've gathered earning all this gray hair,
you got a couple. Not bad.
We've been quite successful of knowing what not to do on patients and how to deal with patients who've had difficulty with previous treatments that haven't come out to the way they've wanted them to.
Right. And I I only can imagine that some of the celebrity status NFL players, I mean, they're going to have a pretty high standard of what they want to look like when they leave the place.
Well, one of the things that when the Raiders first came down here, a lot of the guys were, I'm, of course, been trained to promote dental health. A lot of them were interested in wanting to do commercials, so right. we sort of evolved on that together. But the experience of being able to understand what a patient wants and what will look good for them is an art and a science to itself.
So Valencia, California, Magic Mountain, say someone lived in Texas and they wanted to get like an implant or something like that, would it be far for seeing for them to take a trip out here, go to Magic Mountain, get an implant somewhere along those lines, or get some work done?
Well, I think if someone is going to have an implant done, which now we would expect to last virtually the rest of their life,
right.
20 plus years or indefinitely, I think one would want to invest that kind of time and energy and expense to be guaranteed of a predictable result.
Right.
And whether you're going around the corner or you're going to Magic Mountain, you want to be assured that you're going to get what you're expecting to do.
Absolutely.
And consequently, that's why, because we've been able to deliver predictable care for so many years, our patients stick with that formula.
Gotcha. Phone's ringing off the hook here. I like that. That means means you're busy. Okay, so for people to get a hold of you, what's the best way to get a hold of you? Because when you Google Dr. Durst, it's tough. That's a tough one to remember to spell. So your website right now, I know we're gonna do some stuff with that, but what is it right now?
Dr. D. Valencia Dentist. Yes, I'm checking with the staff because
that's normal. Just so you know, doctors don't know.
They keep me on the straight and narrow. I can.
And the phone number for the people that just refuse to go on the internet.
661-259-3700. And Jamie runs the front desk, and she's the boss.
That's the case.
But everybody knows that.
Yeah, and women in general. Yeah. Your office, I mean, is just. I've never been in one at this state of the art. You have a full-on internet, which is my favorite thing. And it looks like you can watch TV during things and stuff like that, and it's pretty high tech.
We stay on the cutting edge. Our equipment, our X-ray machines, all of our treatment modalities, we stay absolutely top drawer.
All right, so your smile's permanent. You want a great smile and do a great job. I highly advise giving Dr. D a call. Great talking to you.
Good to see you again, Chris.
All righty.